Hi, I'm Megan Williams, and I'm very excited to share our partnership with the System Healthcare and Infinity Teleradiologists. We're so excited to be a preferred vendor and a partner for healthcare solutions. We know as 1099 income earners, sometimes finding great healthcare is difficult. So I'm going to run through some options that we can provide to you and your household to see what could be a fit and be a solution for long-term coverage that will meet what you are looking for. So first thing I want to do is I want to share with you your options. We know the marketplace or ACA, Obamacare, is something that a lot of independent contractors utilize for healthcare. There are limitations to it though for venues and across the country, national access. And so that's why we're not going to talk about that today. The second thing that we also know about are group plans. And since this group is 1099 employees, we're going to not look at that option as well because it doesn't exist. Instead, there are three other options that are out there when you have the right provider: traditional copay plans, limited benefit plans, and private options as well that are funded with groups that are nonprofit. The neat thing about these 1, 3, and 4 is we're going to share with you what we have available, and we'll have a personal presentation over what can work. So here's an example of a copay plan, major medical, that we can offer. One of the neat things about this is a $4,900 deductible plan. However, we have the opportunity to go from $1,000, $2,500, $3,500, all the way up to $7,250 to help keep the monthly payments lower or to be more comfortable for your budget. In this situation, the best part is preventative care wellness visits are all included outside the deductible, as is telemedicine, 100% included with great pharmaceuticals. The other cool thing about this is the copay. Everything is so affordable. $25 primary care visits, specialists only $40, urgent care $60, and chiropractic is $30. There's also mental health and physical therapy included, screenings, labs, maternity, all the things that you would want in a major medical plan. In fact, no lifetime limits as well. And in this plan, with LifeX, you could choose between 3 different carriers. The PHCS multi-plan covers 92% of the country, Cigna and Anthem that cover 95% of the country. This plan is a PPO plan and offers, again, pricing that feels comfortable for you and your budget. The great part about this is a great plan for bigger drugs and for pharmaceuticals. And because it is an association plan, we get pricing that is affordable and can work in our budgets as well. And depending on which carrier you pick and which network you pick, and then which deductible, the pricing can vary. And that is really, really nice. The $4,900 deductible copay plan on the PHCS network. Add a little bit more, you can include Cigna, and then the most expensive is Anthem Blue Cross, being the largest carrier in the country. The neat thing again about this is we can find what fits for you and your health, because there are some underwriting questions that need to be passed. And if this doesn't fit, we've got some other plans that could work really well as well. Our next plan that we're going to offer is a major medical ACA compliant plan, but it's called a visit limit plan. Now you take the same network, PHCS and Anthem, and we can offer what is called a copay limited visit. Now, this is for those of us who don't hardly ever go to the doctor. We like traditional insurance. We like the idea of copays, $50 for primary care, specialists, and urgent care after we've met our deductible. And we just say 10 visits a year should be perfect. It has an individual deductible of $250. and a family deductible of $500. And then after that, all the copays come into place. Now, we're saying we don't plan on using this. Now, will emergencies happen? Absolutely. This has an ER copay of $250, outpatient procedures, $250 plus copay, or excuse me, plus deductible. We have inpatient hospitals in the ICU and regular inpatient hospitalization surgeries with a $1,000 deductible. This can work for those of us who are generally healthy. We don't need major prescriptions. And again, we might only be seeing a dermatologist, a few healthcare, mental health things sporadically throughout the year. This is a great plan for budget conscious. Here's an example of the pricing for this plan. It is age banded on the PHCS. And then, of course, we also have the Anthem options as well. The neat thing about this plan is it's major medical. We just commit to limit our visits and utilize the telemedicine more often, the mail-in pharmaceuticals so we can have free. And what's great about this is it covers if something should come up. And as you read through the summary of benefits, you'll see it includes radiation, cancer, all the things that could happen, but we're not expecting it to happen with where we're at in our life and in our health. So that might be a great option for a budget-friendly premium every single month. Our last plan I want to share is a non-insurance alternative. This plan has been a great resource for many independent contractors because they're generally healthy. They don't really go to the doctor that much, and they don't have any pre-existings that would limit the coverage in the future. And we'll talk a little bit about this. This plan, though, is designed with a nonprofit group called Impact Health. What's neat about this plan is that it is full comprehensive medicine. However, because it's not for profit, it's a non-insurance alternative, but there are some great advantages. The lowest family deductible or primary responsibility amount for the household is $2,500, and the highest is $10,000 for the year. It has a 10/90 split, meaning the max out of pocket is only $5,000 per household, depending on which deductible you pick. Most members pick a $2,500 deductible with the max out of pocket of $7,500 for their household. Now, with this plan, it does not have a copay. It's set up similar to an HSA. That means when you go to your doctor outside your annual physical every year, if you see a specialist, they have provider fee options you pay when you go to the office, and then they take the bill, send it to Impact, and do what's called reference-based pricing. We then pay the rest of the bill, and it gets applied to our deductible. Once we meet our $2,500, everything goes into 10% for any remaining things for the year. The neat thing about this is, though, is our monthly cost for the premium is much lower. It has amazing pricing on pharmaceuticals, but one of our favorite features for members on this plan is holistic credit. That means they have what's called a health and wellness credit, HAWC. Up to $150 of things you're already spending can be applied to your PRA or deductible every single month. So if you have a membership to a gym, if you take supplements, if you see holistic doctors for hormones, things that normally aren't included in medical and major medical providers, this can be applied to your deductible. It also has dental vision discounts as the group is huge and continues to grow. And because it's inclusive, yes, they use the federal mandate and the religion adage of love your neighbor. There is no religious requirement to be part of this group. No household is vetted. It is just, do we agree to love our neighbor and be honest in our dealings? And they are very good fiduciaries of our money, and they make it work for not only us, but the group to keep costs low. We like this because the bill negotiations also helps, and it protects us from future risk. But again, this is a privatized group, a non-insurance alternative. It has no network. It's similar to a PPO. However, the only caveat is A lot of carrier or providers don't know impact yet. And so it's just making that introduction. And if that's okay, then this is a great option for you as well, which we really like. This group, however, does have a 36-month pre-existing clause. It's not all or nothing, but it does help you to understand what could be your future risk if something that was pre-existing were to come to light, and we could have a discussion about it. Here is the pricing, and it is also age banded in this group. And what's nice about this, again, the affordability of this group is amazing. For the Infinity teams, we want you to know that these are just some of the selections that we can look at for your family and your household needs. What we would love to do is have you fill out the link that gives us a little bit of summary explanation of your family and what you're looking for. And you personally has a few health care questionnaires. And then we would set up time to discover where is your comfort level, what are you interested in, and pick the right fit for you and have it be something that could be a long-term solution. I'm so excited to represent the system healthcare, to work with the Infinity teams, and to be a provider with all different carriers and resources you normally wouldn't have. Looking forward to having a conversation soon.